In this lecture, we will discuss about the internal iliac artery. As we know, the abdominal aorta it undergoes iliac quadrification at the level of fifth or the sixth lumbar vertebrae. That means it gives two external iliac arteries and two internal iliac arteries. The external iliac artery they supplies to the hind limb, while as the internal iliac artery they supplies to the pelvic wall and the viscera. Now here in this lecture we will discuss about the internal iliac artery. The internal iliac artery is called as hypogastric also. So it supplies to the pelvic wall and the viscera. So the internal iliac artery, each internal iliac artery passes obliquely downwards and backwards on sacrosciatic ligament and terminates at the level of the lesser sciatic foramen into an posterior gluteal artery and internal pubic artery. So first we will discuss about the collateral branches of the internal iliac artery. The first collateral branch is a large common trunk which gives a branch that supplies to the ureter, and the common trunk in males it divides into the umbilical artery and the vesical artery. The umbilical artery is present in the fetal life, and in the adults it forms the round ligament of the urinary bladder, while as the vesical artery it supplies to the urinary bladder in case of the males. While as in case of the females, the common trunk it divides into the umbilical artery and the middle uterine artery. The umbilical artery we discuss that they are present in the fetal life and they form the round ligaments of the urinary bladder. Whereas the middle uterine artery is supplies to the horn and the body of the uterus. And this artery it anastomoses with the anterior uterine artery which arise from the abdominal aorta in front and posterior uterine artery behind which arise from the internal pubic artery. The second collateral branch is a short common trunk which divides into sixth lumbar artery. The first five pairs of lumbar artery they arise from abdominal aorta, while the sixth one they arise from the internal iliac artery. Then the next is the iliolumbar artery. It supplies to the sacroiliac articulation. And the third branch which arises from this common trunk is the anterior gluteal artery. The anterior gluteal artery it passes through the greater sciatic foramen and it supplies to the middle and deep gluteus muscles. Two important muscles that are supplied by the anterior gluteal artery are middle and the deep gluteus muscle. Now the third collateral branch is the vesicogenital artery. Vesicogenital artery it also arises from the internal iliac artery, but from the ventral surface or ventral face. It supplies branches to the ureter, urinary bladder, vas deferens, seminal vesicles, prostate, and the urethra. Now coming to the terminal branches. As we have discussed that the internal iliac artery that terminates at the lesser sciatic foramen into posterior gluteal artery and internal gluteal artery. And during the course, the internal iliac artery gives a large common trunk, then a short common trunk, and vesicogenital artery. They are the collateral branches. Now, the terminal branches. First one is the posterior gluteal artery, which passes through the lesser sciatic foramen, and it supplies to the biceps femoris and middle gluteus muscle. Now, the second is the internal pubic artery. The internal pubic artery, it is actually the continuation of the internal iliac artery. The internal pubic artery, it gives vesicle branches, it is muscular branches, and cutaneous branches. The vesicle branch they supply to urinary bladder, the urethra, the seminal vesicle, the prostate, the Cowper's gland, and rectum. While as the muscular branch they supply to the retractor ani muscle, obturator internus muscle, and the cutaneous branch they supply to the skin. Now, the internal pubic artery it passes down the ischial arc, and in males, this artery divides into the dorsal artery and the deep artery. The dorsal artery it supplies to the glans, and the deep artery it supplies to the erectile tissue, that is corpus cavernosum. While as in case of the females, it gives a posterior uterine artery. Posterior uterine artery supplies to the uterus and the vagina, and terminates as an artery of the clitoris. So this whole lecture was about the internal iliac artery.